Hello all, welcome to my channel Weight Lecture. Today we will discuss multiple choice questions on veterinary pathology. Question number first. The order of occurrence of rigor mortis is options A, head, neck, trunk, limb. Options B, head, limb, neck and trunk. Option C, limb, trunk, neck and head. Options D, trunk, limb, head and neck. The right answer is options B. That is a at first the rigor mortis begin from head and then move forward to the limbs and then neck and then trunk. है ना? If we see that order at which rigor mortis disappear, then it's head, neck, trunk, and the limb. Okay, the rigor mortis start at 1 to 8 hours after death of the animals, and rigor mortis disappear at 20 to 30 hours after the death of that animal. Okay, after disappearing that the rigor mortis, that it doesn't reappear. And if we see that most commonly displaced organs after death, that is intestine changes its place after that the death. Okay, questions number second. Delivery of leukocytes, particularly neutrophils and monocytes, to the site of injury is known as options A, cellular response of injury, options B, vascular response of injury, option C, physiological response of injury, or options D, all. The right answer is options A, that is a cellular response of injury. When there is an injury, then the leukocytes, particularly neutrophils and monocytes, move toward the site of injury. That is known as a cellular response of injury. And if we see that sequence at which leukocytic events take place, that is first is that marginations. Margination is the process at which that leukocytes move toward the wall of that blood vessels. And then there is the adhesions. Leukocytes adhere toward the wall of the blood vessels, and there is a immigration. Leukocytes crosses that the blood vessels, and there's a chemotaxis and phagocytosis, and finally extracellular release of leukocytic product. And if we see that first line of defense, that is when there is a infections take place, that is a neutrophil, while second line of defense is macrophages. Okay, the chemical substance which induce inflammations and reaches at the site of inflammations in second, that is known as chemical mediator. We already discussed about chemical mediator in previous video. Since the substance, these chemical mediators are inactive forms, and the substance which activate this inactive chemical mediator, that is known as activator. And here the examples of activators like cytokine, leukotriene, and prostaglandin. Cytokines are actually produced by activated lymphocytes and macrophages. Leukotriene is generated by lipooxygenase pathway, while prostaglandin is generated by cyclooxygenase pathway. Okay, if that cytokines act on a same cells, that reduce them, that is known as autocrine effect. If the cytokine act on that cells on vicinity, immediate vicinity, that is known as paracrine effect. And if the cytokines act systematically, that is known as endocrine effect of cytokine. Okay, questions number 3. The anti-enzymes which inhibit the pus formations in tuberculosis consist of options A, saturated fatty acids, options B, unsaturated fatty acids, option C, mixture of both, options D, consist only protein. The right answer is options B, that is unsaturated fatty acids. The anti-enzymes which inhibits the pus formations in case of that tuberculosis mainly consist of unsaturated fatty acids. And if we see that pus is actually composed of necrotic tissue, neutrophils, and other constituents of inflammations exudate extra. And the nature of a pus is alkaline. And if we see that streptococcus and staphylococcal infections mainly produces white or yellow color pus. Corynebacteria produces greenish color pus. Disintegrated hoof material produces black color pus. Pyocananius bacillus produce blue-green color pus. And if we see that at much the extent of proteolysis take place, it determine that the more the viscous the pus, that is the extent of a proteolysis determine viscosity of a pus. Okay. Questions number 4. The cells which cannot undergo mitotic divisions in postnatal life is known as options A, that's permanent and non-dividing cells, options B, labile and continuously dividing cells, option C, stables and quiescent cells, options D, none. The right answer is options A, that is permanent and non-dividing cells. The cells which cannot undergo mitotic divisions in postnatal life, that is known as permanent and non-dividing cells. If we see that example of a permanent and not dividing cells, that include nerve cells, skeletals, and cardiac muscle cells, extra. The cells which continuously divide throughout the life, that is known as labile and continuously dividing cells. Examples of labiles and continuously dividing cells includes epithelium, cells of splenic lymphoids, and hemopoietic tissue. while the cells which has low level of proliferations and that undergo that rapid divisions in response to the stimulus, that is known as stables and quiescent cells. If we see that example of stables and quiescent cells, that is parenchymals, mesenchymals, and vascular endothelial cells. Since the epitheliums in blood vessels, epidermis, mesotheliums, tendon, ligament, cartilage, bone. There's a regeneration, there's a repairs by regeneration process take place. While regenerations cannot occur in nerve cells, secretory epithelium of a gland, and seminiferous epitheliums. Okay, the main structures component which remain stuck or that stables for that regeneration, that is a basement membrane. Okay, questions number 5. Which wound is healed by first intention? Option A, excessive loss of tissue. Options B, healing of open wound. Option C, healing of closed wound. Options D, both A and B. The right answer is option C. That is a healing of a closed wound. Okay, healing of closed wounds occurs by first intention or primary intentions when there's that wound edges are approximated like sutures, stabbles, or glue. In healing by first intention, the resulting tissue is called that cicatrix or scars. In that closed wound, that healing begins that within 12 hours of that the wound formations. In first intentions wounds, that granulations tissue appears on day third. Okay, while healing of that open wounds or when there is a excessive loss of tissue, healing occurs by means of second intentions when the wound edges are not approximated and wound needs to heal from that bottom. And that the pus is visible in open wounds by second days, and macrophages replaced neutrophils in open wounds in 48 to 72 hours. That is 2 to 3 days. Okay. Uh, when there's a movement or a trauma that prevents healing of the tissue wounds, and at that time that granulation tissue continues to produce in excess, that is known as a proud flesh. Okay, and after that healing of the wound, there's a scar formation take place, and if that when a scar continues to grow, that is known as the mass of connective tissue, that is called keloids. Okay, here's a substance like glucocorticoids, cortisone, penicillin, and decreased polysaccharides labels, advanced ages, and low protein diet, and chalone. Chalone is a substance which reduces that mitotic divisions. These all are that the factors which decrease healing process, while the substance like protein, carbohydrate, arginine, glutamine, polyunsaturated fatty acids, vitamin A, vitamin C, magnesium, copper, zinc, iron, that promotes wounds healing. Okay. Questions number 6. Which of the followings are neoplastic cells? Option A, transform cells. Options B, tumor cells. Option C, both. Option D, none. The right answer is option C, that is both. Both transform and that tumor cells are the example of neoplastic cells. Let's see some facts related to that tumor. That's the study of tumor is known as oncology. Tubercular lesions is example of reparative process. Okay, if you see that characteristic of neoplasia, then when the cells proliferates continuously without the purpose of proliferations, that is known as a neoplasia. And if you see that characteristic of malignant tumor, that is a anaplasia. Anaplasia is case that's a new cells which replaces the old cells are immature as compared to the old cells. Invasiveness, and then presence of abnormal mitotic cells and atypical blood vessels, that is neovascularizations. Losses of polarity, there's a and metastasis, that's the tumor cells transform from one organ to another, that is mainly occur through that lymph and blood. These are the characteristic of malignant tumor. And if you see that most susceptible age for cancer in men, that is after 50 years. In cattle, that is after 8 to 10 years, and in dog it is after 5 years. Okay, and that eye cancer is more common in Hereford breed of cattle. Malignant melanoma, which is a cancer of skin, is more common seen in gray and white color horse. Tumor of sweat glands, mammary glands, and venereal tumors are common in dog. That is mainly seen in primarily seen in that young dog as compared to that old dog. Okay, and the carcinogens is substance which that induces oncogene to produce like tumor. There's a carcinogens which is present in tar, that is known as a benzopyrene. Carcinogens causes bladder carcinoma, that is cyclic hydrocarbon of naphthalene. Carcinogens synthesized from cholic acid, that is methylcholanthrin, that causes of carcinoma of urinary bladder in human, that is schistosoma hematobium. Causes of carcinoma of esophagus in human, that is known as Spirocerca lupi. Causes of carcinoma of papilliferous cyst adenoma of a bile duct epithelium in rabbit, that is Eimeria stidi. and soppy fibroma in wild rabbit is caused by virus. Okay. Complete carcinogens, since carcinogens has the capacity of both, that is initiations and then promotions of that tumor formations. The complete carcinogens has the both characteristic, that is initiations and promoter. Okay, both capability. Initiators, as compared that all initiators are all carcinogenics, while promoters are all non-carcinogenics, while complete carcinogens has the capacity of both. Okay. uh, if we see that spread of a pathway, spread pathway of that tumor, then the spread of that sarcoma, which is a connective tissue carcinogenic tumor, is that most favored pathway is that hematogenous pathway, that is a transfer from by mean of blood. And most favored pathway for spreads of carcinoma, which is epithelial cells carcinogenic tumor, that's lymphatic pathway. And while most favored pathway for spreads of malignant tumor of mucus and serous surface, that is a transcoelomic pathway. Okay. uh, Questions number 7. In lungworm disease, fecal sample preserved by options A, refrigerations, options B, additions of 10% formalin in 1:4 ratio of fecal materials, option C, addition of 20% formaldehyde in 1:4 ratio of fecal materials, or options D, addition of 40% formalin in 1:4 ratio of fecal sample. The right answer is option A, that is a refrigerations. Okay. In lungworm disease, that fecal samples which is taken for the diagnosis purpose is preserved by mean of refrigerations, while nervous tissue is preserved in 70 to 80% alcohol or 95% methylated spirit. Materials that containing a virus should be preserved in 50% glycerin. Okay, that optimum size of tissue for preservation, that is a 2 to 3 in length, 2 to 3 centimeter length, 1 to 2 centimeter in wide, and 0.5 to 1 centimeter in height. Okay. Fecal sample should be preserved in 5% formalins. Okay. Fecal sample which is suspected for coccidia should be preserved in 1% formalins or 2.5% potassium dichromate. Okay, serum is preserved in phenol. Milk is preserved for bacteriological examinations in ice. Okay, milk is preserved for tubercular organisms by 0.1% boric acid. Urine is preserved for bacteriological examinations in ice. Urine is preserved for chemical examinations in pure formalins. Blood smear for chemical examinations are preserved by potassium oxalate. Okay, blood smear and pus smear for bacteria are fixed by passing slowly over the flame, while blood smear for protozoa are fixed by methyl alcohol. Okay. There's a note that heparin, which is a natural anticoagulant, is added in a blood sample at a rate of 0.2 mg per ml of blood. Okay. Questions number 8. In histopathological technique, dehydration is done by options A, descending series of alcohol, options B, ascending series of alcohol, option C, absolute alcohol, options D, diluted alcohol. The right answer is options B, that is ascending series of alcohol. In histopathological technique, dehydration is done by ascending series of alcohol. Since dehydration is a simply process of removal of water from aqueous fixed tissue, since most fixed strips are aqueous in nature, this step is necessary to prepare a tissue for embedding in that non-aqueous media like paraffin. And that for the dehydrations, tissue dehydrations, alcohol is most commonly used in lab. And since they miscibles with aqueous fixed strip like 10% formalins, in this step, that's alcohol replace that penetrate tissue and quickly replace water. Okay, size of the tissue sections in sections cutting of histopathological technique should be 4 to 6 micron. Okay, and histopathological technique, tissue can be fixed by the 10% formalin, Zenker fluid, Carnot fluids. Carnot fluids require shortest time for fixations, since tissue can be fixed by either by means of physical means like that flames and dryness, or by chemical means by use of these chemicals. Okay. Clearing, this is also another steps in histopathology process. There's a clearing is a process of replacing this dehydrated agents with that dehydrated agents with that substance which is mixed with or embedded mediums or paraffin wax. Most commonly used clearing agents of a tissue are that xylene or benzene, cedar wood oil, chloroform or carbon tetrachloride extra. Okay. Questions number 9. Blue baby condition is due to which anomaly? Options A, patency of foramen ovale. Options B, interventricular foramina persistency. Option C, ectopia cardis. Options D, Diplocardia. The right answer is option A, that is patency foramen ovale. Okay, blue baby conditions is a conditions in which there is a baby appears as like a bluish in colors due to the venous circulation of a venous fluids, okay, venous blood, and it is commonly since due to that patency foramen ovale. Patency foramen ovale means like there's a persistence of that the hole between the two interarterium, that's the right arteriums and the left arteriums, connected with a hole, okay. While chatrology of Fallot, that's a combination of four congenital heart defect like ventricular septal defect, where the two ventricular ventricles are connected, pulmonary stenosis or that misplaced aorta, and thickened right ventricular wall, which gives blue baby's condition in human. Okay, ectopic carditis, that's the conditions in which that heart is present outside the thorax. Okay, diplocardia, when there's a two heart is present, that is known as a diplocardia. Systolic murmur is a special types of that the sound which is produced when the heart contract. It presents in interventricular foramina persistency, pulmonic and subaortic stenosis. Okay, if clot is completely block the heart, that condition is known as cardiac tamponade. Okay, the commonest cardiac anomalies is interarterial septal defect, that is a patency foramen ovale. Okay, patent ductus arteriosus. Patent ductus arteriosus conditions in which the two duct, that is the aortic duct and that the pulmonic duct, both are connected, and is known as also known as the ductus botali. Okay, and when there is a great dilations of heart, that condition is known as cor bobinum. Okay, questions number 10. In shock, toxemia or hypoxemia, which type of hemorrhage are seen commonly? Options A, diffuse hemorrhage. Options B, ecchymosis. Option C, both. Options D, petechial. The right answer is option C, options D, that is a petechial. In case of shock, toxemia, and hypoxemia, petechial's hemorrhage is commonly seen. Similarly, petechial's hemorrhage also seen in case of purpurea hemorrhagia of horse, while in sweet clover poisoning, diffuse and ecchymosis hemorrhage are seen. Okay, traumatic pericarditis is the cause of pyopericardium. In fibrinous pericarditis, that shaggy heart along with bread and butter appearance occurs, and the cause of this fibrinous pericarditis is that rheumatic fever. Cor rojusum, that is a wrinkle or folded heart appearance, is seen in case of suppurative pericarditis. Fine frost appearance of heart is seen in case of uric acid pericarditis. Uric acid pericarditis occurs in fowl that is suffering from that visceral gout. Tubular pericarditis is common in case of cattle. Constructive pericarditis, that's the conditions where that pericardium become thick and stiff, interference with that heart pumping ability. It's mainly caused due to that pyogenic staphylococcal infections and tubercular bacillic infections. Okay, heart that enlarge with that narrowing with the thickened wall and lumen of the chamber get narrow. This condition is known as concentric hypertrophy. While if hypertrophy accompanied with dilation, that is known as eccentric hypertrophy. Okay. Questions number 11. Round heart disease is most commonly occurs in options A, cow. Options B, bitch. Option C, ewe. Options D, hen. The right answer is options D, that is a hen. Round heart disease is characterized by there is a degenerations and deformations of heart and sudden death. Seen in a hen is most commonly seen in case of a hen, that is a fowl. Mainly especially seen in summer seasons, caused due to that fed that diet which is rich in carbohydrate, poor in protein, and also there's a high amount of zinc in there. Okay, while mulberry heart disease is also that metabolic disease, it's also called myopathy. Specifically specific disease of heart muscles, common cause of sudden death, mainly seen in pig, that is associated with that lack of vitamin E and selenium in diet. Okay, heartworm, that is known as Dirophilaria immitis, is a parasite of myocardium and is mainly found in that right ventricle of heart of dog. Okay, cysticerca cellulosa, that's found in heart muscles of pig. Okay, cattle, sheep, pig, extra, all are susceptible to sarcocystic cannula in his heart muscles. In endocarditis, that is the inflammation of endocardium of a bulb is mostly affected, especially that's mitral bulbs in case of endocarditis in dog. Okay. Questions number 12. In which conditions there's inflammations of all three layers of the wall of artery occurs? Options A, equine viral arteritis. Options B, anterior mesenteric arteritis in horse. Option C, polyarteritis nodosa. Options D all. The right answer is option C, that is polyarteritis nodosa. In polyarteritis nodosa, there is inflammations of all layer of the wall of the artery, while equine viral arteritis is an acute arteritis. Questions number 13. If the sac is formed by surrounding connective tissue, not by artery, then it is known as options A, true aneurysms, options B, false aneurysms, option C, secular aneurysms, options D, dissecting aneurysms. The right answer is options B, that is false aneurysms. Okay, aneurysms is just the dilations in that the blood vessels. If the sac is formed that around the dilated process by the connective tissue rather than the artery, then it is known as false aneurysms. Okay, if there is a formation of a pouch on one side of that wall, then it is known as secular aneurysms. Miliary aneurysms is also known as that the berry aneurysms, and it's a aneurysms of that minute small arteries and usually seen in the cranium, and it is congenital in nature. Okay, elastic artery example aorta is a that's a large artery. Okay, hyperplastic arteriosclerosis gives onion skin like appearance of that to that arteries. Okay, Buerger disease is a chronic inflammations of artery. Okay, formations of RBC in fetus life, that is occurs in case of liver, while formations of RBC in case of that young one or that adult life occurs in bone marrow, while erythropoiesis, which is a formation of erythrocytes, and granulopoiesis in poultry is occurs in intravascular, which is occurs within a blood vessels. Okay, after birth that lymphocytes are formed in bone marrow, lymph node, and spleen. Okay, and there's a note that purple colorish cocoid, that is a round granules, which is seen at the periphery of the erythrocytes in animal due to impaired hemisynthesis, that is known as Pappenheimer bodies. Okay. Questions number 14. Polycythemia is option C, increase in circulating RBC and the RBC is normochromic and normocytic. Options B, increase in number of RBC and the RBC is macrocytic and normochromic. Option C, increase in number of RBC and the RBC is macrocytic and hyperchromic. Option D, none. The right answer is option A, that is a increase in number of RBC and the RBC is normochromic and normocytic. Okay. Polycythemia is a condition in which there is an increase in the number of RBC and the RBC is normocytic and normochromic, while relative polycythemia is a condition where there is a total blood volume is reduced, although that the number of RBC remains same. Okay, absolute polycythemia is a normal blood volumes, but increase there is a total number of RBC. Similarly, relative oligocythemia is an increase in a total blood volumes with normal number of RBC, while absolute oligocythemia is a conditions in which there is a productions of RBC by hemopoiesis is equal to that destructions of RBC. Okay. Note, anemia in which there is a production is a low, but that destructions of RBC is normal, that is known as dyshemopoietic anemia. Okay. Questions number 15. Which is commonest symptoms of viral feline panleukopenia? Options A, a granulocytosis. Options B, polycythemia. Option C, anemia. Options D, granulocytosis. The right answer is options A, that is a granulocytosis. Commonest symptoms of viral feline panleukopenia, that is agranulocytosis, was the increase of the number of agranulocytes, that is the monocytes and lymphocytes. Conditions occurs in protozoals and rickettsial infections, that is monocytosis, was the increase of the number of the monocytes. Conditions common in viral infection, that is a lymphocytosis. Cells infiltrate in predominantly in suppurative lymphadenitis, that is known as neutrophils. And there's a note that lymphocytes that are damaged during that the formations of preparation of a smear, that is known as smudge cells. Okay. Questions number 16. Narrowing of bronchial lumen is known as option C, bronchiostenosis. Options B, bronchoectasis. Option C, both. Options D, none. The right answer is options A, that is bronchiostenosis. Narrowing of that bronchial lumen known as bronchiostenosis, while dilations of that bronchial lumens is known as bronchoectasis. Uniform dilations of a bronchus, that is known as cylindrical bronchoectasis, and outpouching of that bronchial wall, that is known as secular bronchoectasis. Okay. Atelectasis is that collapse of alveoli, that is a failure of alveoli to opens and contain air. Collapse of alveoli is always focal. Okay, pneumothorax cause that atelectasis in lungs where there's a air replace that the alveoli. While emphysema is that increased air in lungs. Okay, broken winds or heaves is a chronic alveolar emphysema which is mainly seen in equine. The sequels of heave is hypertrophy and there's a dilations of right ventricles. Okay, if we see that microscopic lesions of congestions of lungs, then there's a alveoli contain red blood cells and heart failure cells. If we see that microscopic lesions in case of infractions of lungs, then alveoli and then capillaries and septa is three all is filled with blood. If we see that microscopic lesions of hemorrhage, then the blood is found in that alveoli, bronchi and bronchioles. Okay, okay, the pneumonia in which that whole lobe is affected, that is known as a characterized by that catarrhal exudate in that alveolus, that is known as lobar or corpus pneumonia. The pneumonia in which only one single in which that lobules is affected, characterized by that's also catarrhal exudate of alveolus, that is known as lobular or catarrhal or bronchopneumonia. This is a most common pneumonia in animal, and in this case that anterior and ventral part of lungs is commonly affected. Okay, stages of pneumonia, that's the first stage of congestions, stage of red hepatizations, stage of gray hepatizations. Okay, hepatitis is a process in which that lung cells is less become as like of a liver cells. Okay, in aspiratory pneumonia affected part is that greenish or black in color, while verminous pneumonia, which is the occurs due to that helminths parasites, there's a there's inflammations of alveolar septa in case of interstitial pneumonia, characterized by presence of hyaline membrane and fertilizations or epithelializations of lungs. In mycotic pneumonia, we can see that the nodules, lesions in that trachea, bronchi, and air sac. Okay. In Jagasicti, which is a contagious carcinoma affecting lungs of sheep, mainly caused by retrovirus. In that case, that alveoli show adenomatosis and lesions are focal. While in MIDI is like a respiratory disease of sheep, mainly caused by a lentivirus. Lymphadenitis occurs and lungs is not collapsed while thorax is open. Okay. Questions number 17. In which gastritis mucosa may be thrown into polypoid fold? Options A, chronic gastritis. Options B, catarrhal gastritis. Option C, acute hemorrhagic gastritis. Or options D, none. The right answer is options A, that is chronic gastritis. In chronic gastritis, mucosa may be like thrown into polypoid folds. Okay, while strongylus parasites cause catarrhal gastritis. In gastric ulcer, that is a hill gastric ulcer, have a star-like appearance. Okay, Meckel's diverticulums is a persistent omalomesenteric duct. Okay, cecum undergo torsions more in case of there's a cattle, while left and transverse colon undergo torsions more in horse. Intussusception is a process where there is a telescopy of a portion of intestine into that another, usually anterior into posterior. Mostly occurs in jejunum and cecum in case of dog and cattle. And violent straining during parturations or defecations is that a major cause of hernia. Hernia is nothing, that's a replacement of that organ from the normal position to that outside, comes out through that the natural openings. Okay, umbilical hernia is most commonly seen in case of foal, calf, and pup. Okay, when hernia doesn't have there's a covering, parietal peritoneal covering of viscous, that is known as false hernia. Example of false hernia, that's diaphragmatic hernia. And in this case, when we open the skin, it will reveal the bobble in case of that false hernia. That is called inventurations. Okay, in pig, a predisposing factor of enteritis, that's inflammation of intestine, is deficiency of animal protein and trace elements. Okay. Questions number 18. Hepatitis is option C, inflammations of liver. Options B, alternative inflammations of liver. Option C, inflammation of liver not associated with degenerations. Options D, none. The right answer is options B, that is alternative inflammations of liver. Hepatitis is alternative inflammations of liver, while cirrhosis is a chronic hepatitis. Cirrhosis is mainly characterized by there is a fibrous tissue formations, degenerations, and hyperplasia of hepatic cells. Okay, periportal necrosis, that is a necrosis of hepatic cells near that portal vein, is commonly seen in phosphorus poisoning. A peculiar type of wedge-shaped necrosis occurs only one side of a central vein, that is known as a paracentral necrosis. Okay. Questions number 19. increase of non-proteinous nitrogenous materials in blood due to dehydrations, rapid breakdown of a protein, or increased metabolisms is known as options A, that is known as uremia, options B, azotemia, option C, creatinemia, options D, proteinemia. The right answer is options B, that is azotemia. Increase of non-proteinous nitrogenous materials in blood due to dehydrations, rapid breakdown of a protein, or increased metabolism, that is known as azotemia. While azotemia occurs due to that the renal cause, that is known as uremia. Toxic syndromes resulting from renal insufficiency, also known as uremia. Uremia is mainly characterized by there's a hyperplasia of a parathyroid gland, metastatic calcifications, and this hemopoietic anemia. Okay, cyst in kidney is both, that sometimes is congenital and sometimes acquired conditions. Okay, degenerative lesions, degenerative renal lesions, that is known as nephrosis. Okay, in hydronephrosis, whole kidney is converted into a bag with a thin paper like capsules. Okay, in lower nephrosis, in lower part of nephrosis, lesions are found in ascending loop of Henle and distal convoluted tubules due to large quantity of hemoglobin excreted through kidney. Okay, in a dog and cat, oxalate nephrosis occurs by swallowing a large amount of ethylene glycol. In mercury poisoning, sulfonamide poisoning, oxalate nephrosis, uh, lesions are in proximal convoluted tubules. Okay, to prevent sulfonamide nephrosis, sulfonamide is administered along with like sodium bicarbonate and that water. Pyelonephritis is a suppurative nephritis. Okay, there is ascending infections, stasis of urine is predisposing factors for pyelonephritis, characterized by inflammations of all part of kidney involving pelvis and parenchyma of kidney. Okay, most common type of nephritis in animal, that is interstitial nephritis. Questions number 20. Which nephritis is due to antigen antibody reactions to foreign protein? Options A, pyelonephritis. Options B, interstitial nephritis. Option C, tubular nephritis. Options D, glomerulonephritis. The right answer is options D, that is glomerulonephritis. Glomerulonephritis is due to that antigen antibody reactions to foreign protein. Glomerulonephritis occurs in case of horse, which are used for anti-sera productions. Okay, small granular contracted kidney with a thickened that capsules that is peel with difficulty, that is known as chronic interstitial nephritis. While in acute nephritis, kidneys of normal size are slightly enlarged and capsules strikes not off easily, that is known as acute interstitial nephritis. In acute interstitial nephritis, heaviest infiltrations of lymphocytes and plasma cells occurs at corticomedullary junctions. Okay, and large white kidney with an epithelial crescents in Bowman capsules is a characteristic lesions which is seen in case of subacute glomerulonephritis. Okay, if that is a presence of a cast in urine, that is known as a clinduria. Okay, note hyaline cast is cylindrical in shape and colorless and dissolve in acetic acids. In pyemic or embolic nephrosis, abscess found in case of cortex, and this abscess are circular in nature, while in case of that abscess which is found in medulla, that's elongated in nature. All abscess that found in case of that pyemic or that embolic nephrosis are of same age and size. Questions number 21. Incomplete. Questions number 21. Paresis is options A, incomplete loss of motions. Options B, complete immobility of muscles. Options D, option C, any of above. Options D, none. The right answer is paresis is incomplete loss of motions, while paralysis is a complete immobility of muscles, while in paraplegia, which is a paralysis of only that hind limbs, is arises mainly in cord, that is medullary cord. Okay. Questions number 22. Which inflammation does not occurs in brain? Options A, catarrhal. Options B, fibrinous. Option C, suppurative. Options D, both B and C. The right answer is option A, that is catarrhal. Catarrhal inflammations doesn't occurs in brain. Let's see some other facts related to brain. That's when a neuron is damaged, that oligodendroglial cells and microglial cells crowds around that such cells without actually invading them. That is known as satelitosis. When the died nerve cells are invaded by that's microglial and oligodendroglial cells and removed by phagocytosis, that is known as neuronophagia. in which that nerve cells become irregular, nucleus become pycnotic and clumping and condensations of Nissel's granules, and this is sclerosis of process take place. Okay, anomalies in which there is an absence of most of the brain, that is known as anencephaly. Encephaly terms stand for brain. Okay, complete failure of a cranial development, that is known as acrania. Absence of spinal cord, that is known as amylia. Defect in the wall of spinal cord, which is caused by the lack of union between the lamina of vertebra, that is known as spina bifida. Okay, if there is a hernia of spinal cord, that is known as rachis. If there is a hernia of meninges, that is a covering of that brain and spinal cord, that is known as meningocele. If there is a protrusions of a brain, that is known as encephalocele. If there is a congenital fissures in cranium, that is known as a craniocysis. Okay, in internal hydrocephalus, accumulation of that cerebrospinal fluids take place in that ventricles, while in external hydrocephalus, that accumulation of cerebrospinal fluids occurs in subdural space. Okay, inflammation of a dura mater is known as that is a patchy meningitis. Inflammation of a pia mater is known as that's a leptomeningitis. Inflammation of a gray matters of that spinal cord is known as poliomyelitis. Poliomyelitis. Okay. Questions number 23. Kumri in horse is caused by options A, Toxoplasma gondii, options B, Sataria digitata, option C, Coinuras cerebralis, options D, Hypothermia bovis. The right answer is options B, that is Sataria digitata. Kumri is characterized by there's a paralytic conditions. There's a lumbar paralysis, which is mainly seen in sheep goat, mainly in horse. It's mainly caused by the presence of larva of Sataria digitata in that CNS. Okay, while Toxoplasma gondii is an obligate intracellular parasite of cat. Cat is a definitive host. It's mainly cause coagulative necrosis in brain. Okay, Hypothermia bovis, also known as hill flies or gad flies, mainly found in the fat of vertebral canal and form cysts and warbles on skin. The cause of study or GID in that ship is Coinuras cerebralis. That's a larva form of Tinea multiceps. Okay. Questions number 24. Curvature of the spinal with ventral convexity is known as options A, kyphosis, options B, lordosis, option C, scoliosis, options D, apodia. The right answer is options B, that is a lordosis. Okay. The right answer is options B, that is a lordosis. Okay. Abnormal curvature of spinal cord with ventral convexity, that is known as lordosis. And whereas there is a lateral curvatures, lateral bending of that spinal cord, that is known as scoliosis. And there's a dorsal bending of a spinal cord, that is known as kyphosis. Kyphosis. Okay. Questions number 25. Absence of the posterior limbs is known as options as kyphosis, options B, lordosis, option C, apodia, options D, scoliosis. The right answer is option C, that is apodia. Absence of the posterior limbs, that is known as apodia. Absence of the anterior limbs, that is known as abrachia. Absence of that limbs, that is known as amelia. Absence of that some of the toe, that is known as parodactyly. Absence of all toe in the limbs, that is known as adactylisms. Fusions of the toe, that is known as syndactylisms. And that abnormal shortening of the toe, that is known as brachydactylisms. Okay. Questions number 26. Osteodystrophia fibrosa in horse is known as option C, Brand disease, options B, big head disease, option C, Miller disease, options D, all. The right answer is options D, that is all. Osteodystrophia fibrosa in horse, known as Brand disease, renal rickets, rubbery jaw, big head disease, Miller disease, extra. Osteodystrophy fibrosa occurs when a horse fed the ration which is contain high cereal phosphorus and limited calcium level. Okay. Questions number 27. Okay. Exostosis of osteophytes have the structures of options A, compact bone, options B, spongy bone, option C, spongy bone but do not have Haversian canal, or options D, compact bone but do not have Haversian canal. The right answer is options D, that is a compact bone but do not have Haversian systems. Exostosis is nothing, it's a benign outgrowth of cartilaginous tissue on a bone of osteophytes have a structures same like of a compact bone, but it's lack Haversian systems. If exostosis that is found in first and second phalanx, then it is known as ring bone. If exostosis occurs at the end of a metacarpal and then metatarsal bone, that is known as a splint. If exostosis occurs on the medial portion of the distal tarsal bone, that is known as spavin. When serous fluid is in considerable amount in joint, that is known as joint gall. Where there is an inflammation of hip joint, that is known as coccytitis. Small vertebral articulations become ankylosed, that is known as ankylosis spondylosis. Okay. Example of a bursitis, that is bogus favins, and there is a hygroma of a carpal joint, that is known as bursitis. Okay. Serious bursitis of hock joints in a horse, that is known as bogus favin. Cap elbow in horse involve hock joints. Okay. Polyval or fistulous wither in horse caused by brucella organisms involve hock joints. Okay. Questions number 28. Hypothyroidism cause which disease in young growing animals or young growing children? Option A, mycedema. Options B, cretinisms. Option C, both. Option D, none. The right answer is option B, that is cretinisms. Hypothyroidism cause cretinisms. Cretinisms are conditions mainly characterized by physical deformities and that learning difficulties, which is seen in young growing children, which is deficiency of that thyroid hormones. While cause myxedema, that's a conditions characterized by there's a confusions, swelling of a body, weakness, difficulty breathing in adult in hypothyroidism conditions. Goiter is actually non-inflammatory and non-neoplastic enlargement of a thyroid glands. Okay. Graves' disease is an autoimmune disorder caused hyperthyroidism, that is exophthalmic goiters, mainly characterized by weight loss, nervousness, and sweating extra. Cushing syndrome is a result of hyperfunction of adrenal cortex. Okay. Myasthenia gravis, which is a chronic autoimmune neuromuscular disorder, mainly characterized by fluctuating weakness of voluntary muscles, mainly caused by hyperplasia of thymus gland. Okay. Questions number 29. Thickening of epidermis due to that hyperplasia of cells of a Malpighian layer is known as options A, hyperkeratosis, options B, pachyderma, option C, acanthosis, option D, parakeratosis. The right answer is option C, that is acanthosis. Thickening of epidermis due to that hyperplasia of cells and that of Malpighian layer, that is known as acanthosis. Conditions in which keratin layer is imperfectly formed, but in which that nuclei of that horn cells are retained, that is known as parakeratosis. Thickening of all layer of skin, that is known as pachyderma. Abnormal thickening of stratum granulosum, that is known as hyperkeratosis. Okay. Development in which Malpighian layer undergo abnormal imperfect keratinization, that is known as dyskeratosis. Intercellular edema of that epidermis, that is known as spongiosis. Okay. Sharply circumference, flat, edematous elevations of skin is seen in case of like wheel and urticaria. Discolored spot of that skin which is not elevated above skin, that's known as macula. Congenital lack of feathers in fowl, that is known as epinosis. Abscess of a hair follicle, that is known as furuncles, boils, while inflammations of hair follicles, that is known as folliculitis. Inflammation of sebaceous gland, that is known as acne. That clusters of that boils situated close to each other, that is known as carbuncles. The wall of dermoid cyst contain skin appendages. Okay. Cyst of sweat gland, that is known as sudoriferous cyst. Okay. Questions number 30. Dilations of people is known as option C, myiasis, options B, mydriasis, option C, ankyloblepharon, options D, coloboma. The right answer is options B, that is mydriasis. Dilations of people is known as mydriasis, while constrictions of people, that is myiasis. Conditions in which that's eyelids and ciliary body, lens or iris may showing fissures or gap in their continuity, that is known as coloboma. Okay. Condition in which both the eyelids are fused together, that is known as ankyloblepharon. Okay. Conditions in which lenses is small and sphericals and lens may be opaque or transparent, that is known as microphakia. Conditions in which there is only one eye due to the fusions of that two orbit, that is known as cyclops. The squints of that human being is known as strabismus. Okay. Conditions in which lens becomes opaque, that is known as a cataract. Inflammations of eyelids, that is known as blepharitis. Abscess of that meibomian gland, that is known as chalagion. Okay. Adhesions between that eyelid, that is known as ankyloblepharon. Inflammations of that orbit, that is known as orbital cellulitis. Union between the conjunctiva lining the eyelid, that is known as symblepharon. Okay. Sinking of the eyeball into that the orbit, that is known as inophthalmus. Inflammation of the lacrimal gland, that is known as dacryo adenitis. Conditions in which vascular granulation tissue is found between the corneal epitheliums and the Bowman's membrane, that is known as panus. Anterior synetia is the conditions in which there is a adhesion of that iris to that posterior surface of the cornea. Inflammation of iris and a ciliary body is known as a iridocyclitis or anterior uveitis. Okay, these are the terms which are associated with the different conditions of the eye. Okay, this much for today. Thank you.